What you can see, this is one of the dreadest, one of the most severe type of malnourished children in India. You can see it's shiny area, the skin, it's in swelling. You can see this is not a normal skin.
What happens if it's left untreated?
The patient will die. The child will die within 2-3 weeks. Have you ever seen posters on the wall of the street? They use a glue. The child was fed on that food.
This child was fed on glue?
Yeah. Arrowroot is one type of glue which is used for sticking posters on the wall.
What does it taste like? Does it taste any good?
It's terrible. It's terrible. You can't even imagine the taste of that.
The mother, obviously totally unknowingly, has...
Unknowingly, exactly. Yeah. Malnutrition is not only caused due to poor economic condition.
So this mother could have afforded to feed her child something other than glue?
Definitely.
But she simply didn't know.
She didn't knew that that glue is not a food for the child.
And she wouldn't have read the label?
Most of the mothers are illiterate.
This situation is mother is below 18. According to her mother-in-law, her age is around 16 years. Present age is 16 years. Okay? And since present age is 16 years, she has a very poor knowledge in taking care of the baby. Since she could not feed herself, she don't know how to feed the baby.
বাচ্চার শরীরটা খারাপ আর ওজনটা যাতে বাড়ে সেই চেষ্টা করে।
What she has told is, since the baby is having cough, fever, is not, it's a loss of appetite, she is not feeling hungry, she is not sucking breast milk of her mother. She is just feeling not interested. Some are coming with skin infections, some are coming with diarrhea, loss of appetite, malnutrition related. And along with that, they are having skin infections, having fever, only fever.
So how many patients do you have to see?
45 patients till 12:30 from 9:30 onwards. It will cross around, it will cross to 90.
In 3 hours?
Yes.
That's one patient every 2 minutes?
And on Thursday, it crosses to 300.
Yes.
Most of the children suffering from malnutrition are girl children. And India, though there has been a great improvement in gender biased and all those things, still you may find that in the rural areas, they prefer a boy child because he will be the earning member in the long run.
So, not in this case, but generally speaking, a family is less likely to feed their daughter properly than their son.
Yes, that's why I want to mention that if I have a boy and a girl in the same family, I will take much more precaution and attention in feeding and taking care of the child for the boy child rather than the girl child. If I have the same amount of food, I will give much more amount of food to that boy child so that he will be in the long run a healthier child for income generation.
What about the gender of the babies here?
Most of them are female children here, girl children here.